Hey guys, Richard Wolf here. I'm talkingmedicare.com and I want to come to you today with another video about the parts of Medicare. You say, Richard, the parts, what are you talking about? Is this a car we're driving? No, nothing like that. But there are four distinct parts of Medicare that you need to understand what they are and how they work. So let's talk about them. We got A, B, C, and D. And I will tell you this too as a quick side note, is the acronyms in the Medicare world and insurance in general and the alphabet soup of Medicare supplements and Medicare can get very confusing. So let me break it down for you. Your A, when you come on to Medicare turning 65, you get Part A and Part B if you choose to enroll in both. Part A is going to cover your hospital coverage only. Okay, that's just the facility. Think of it as room and board, like the hotel. Okay? If you get admitted to the hospital, you're going to have a deductible to pay of $1,556. That's $1,556. And that deductible covers you for the first 60 days in the hospital. Now in the Medicare world, that 60 days resets every 60 days. So I say that to kind of make the point that if you're in the hospital, unfortunately, for 5 days, you're discharged from the hospital, you go back in the next 60-day period, you're going to pay that deductible again. And let's remember too, when we come to our definitions, by definition, a deductible is what you pay before the plan starts paying. So before Medicare pays a cent, you'll pay the first $1,556, period. Now you don't get billed for that until you come out of the hospital. But it's important to know there's a deductible just for the building. Now, second thing, let's assume we were still in the hospital. We went in, something more serious, we had to have a surgery done, okay? Well now, Part B kicks in for all the medical services. Your doctors, your testing, your lab work, anything administered through the hospital, maybe it's an infusion, IV medications, whatever it is, that falls underneath Part B of Medicare. Now, Part B has a $233 deductible. So that means of the Part B benefits, you're going to pay the first $233, and then it goes to a 20% of whatever the Medicare approved amount is. So $233 and then 20% of the cost. So if the bill was $1,000 for a test you got done, you're going to pay $200. If the surgery was $5,000, you're paying 20% or $1,000. Keep in mind here too, is when you're in the hospital, every single thing they do has a code attached to it. And every code has a price attached to it. So you're gonna have a 20% cost for anesthesia, infusions, the medicine they drop you in the bag hanging from the stand, the therapist that comes see you, anesthesia in the hospital. I think I said that already, sorry. The doctor coming in to see you. The surgery cost when he does the surgery. Every little thing has a cost attached to it, and that's what you're paying 20% of, okay? Now again, this is just the basic Medicare benefits. We'll talk about supplements, Medicare Advantage, all that stuff later in more detail. So this is the basics for you. Oh, one other quick thing to point out is over 60 days, continuous stay in the hospital, you're going to have a higher per day cost from day 60 to 90, and then it jumps up again from day 90 through 100. And it's in your Medicare and U book for 2022. You can look it up. Actually, those numbers are probably 2021. But I want to say $1,556 deductible for first. Then it's $389 a day after day 60 to 90. And then $778 a day after day 90 up to 100, and then it changes after that. So my point being is it can be pretty expensive to be in the hospital for any extended amount of time, and that's really why you want to look at your Medicare supplement options or Medicare Advantage options, which we'll dig into later. Part C of Medicare, C as in cat, is considered Medicare Advantage, and I've jotted some numbers here too. Page 61 of the Medicare and U book really drills down deep into what the numbers, and not the numbers so much, but how the plans work for Medicare Advantage. And there's a good little phrase they use in there. Medicare Advantage plans is when you allow a private company to manage Medicare for you. Now they're in charge and manage your Part A, your Part B, and your Part D for drugs. All three in one package. And now, depending on what plan you choose, you're going to have to work within the network of that company that you chose. But what they will do is they're going to attach copays. They're going to all the services. Might be $0 to see your primary care. Might be $30 to $40 to see a specialist. $90 in the hospital. Goes through all the Medicare's benefits. So it's very controlled cost based on what your service is. And then give you a max out of pocket. Depending on the plan and what area you're in, it could be as low as $2,000 a year. Could go all the way up to $7,550 per year. Depends on your area. So Medicare Advantage is where you allow a private company to manage Medicare for you. A lot of different thoughts and feelings about Medicare Advantage. For me, I'm not really one way or the other. I just like to educate, show you how it works, and let you decide what you feel like is best for you in your situation, because everyone is different. Okay? So I want to pause and back up for just a moment. So Part A of Medicare, hospital coverage. When you're admitted into the hospital, room and board, the hotel cost is your $1,556. Then it goes up after day 60 and after day 90, if you're unfortunate enough to be in there that long. On page 22 of the Medicare and You book, it's going to give you a good synopsis of Part A and what it covers. Part B of Medicare is your medical insurance. This is where you do pay a monthly premium. To back up real quick, Part A has no premium whatsoever. Nothing. Cost you nothing per month. The Part B does have a monthly premium. Right now in 2022, about 2 weeks from now, you're going to pay a monthly premium of $170.10. That's 170.10 per month for Medicare to cover 80% of your coverage on the medical side. And then you're on the hook for the first deductible of $233, and then 20% of all the Medicare approved amounts after that. So if that's all you have, then those are the numbers, and that's what your exposure is if something should come up. You have to get admitted to the hospital, have a surgery done. Now, if you never go into the hospital, you don't experience that deductible for the hospital copays. You basically just pay your doctor visits. First $233 out of your pocket, and then it drops to 20% of a doctor's visit, lab work, MRIs, ultrasounds, ER visits, whatever that is. But with standard Medicare, A and B only, you have no maximum out-of-pocket costs. So in other words, those 20% in deductibles, as you're spending them all throughout the year, do not have a maximum. So if for some unfortunate reason you're hospitalized and have a lot going on and you incur $5,000, $7,000, $10,000, $20,000 in those costs, deductibles, 20% and all that, that's what you have to work out with the providers. So that's what most people are most concerned about and want to talk to agents like myself about Medicare supplements or Medicare Advantage. That's a deeper conversation for another video. But that's the A and B. And in Part C, Medicare Advantage. Okay? So if you have your Medicare and You book and you got questions about this and you really want to understand better, pull it out and look at these pages. Page 61 through 74 talks in great detail about the Medicare Advantage options. Page 23 talks in more detail about Part B of Medicare. Quick note on Part B, in your Medicare and You book, anything you see that has an apple on it, next to it, that designates that it's a preventive service. What does that mean, Rich? Well, that means that's something that your doctor can do for you and order that test and cost you nothing whatsoever out of your pocket, no matter what you have. Okay? So, bone density tests, mammograms, annual checkups, flu shot, pneumonia shot, and it goes down the list. And there's quite a few things in there a lot of people don't know it's available. Most doctors will run most of those tests because they get paid every time they do one. But you might see something in there that might be more specific to you that you might be concerned about. So just check out in your Medicare and You book. And then Part A on page 22 is a good section that talks more about the Part A benefit and what it covers and such. But then also page 4 through 6, right in the beginning, has some good little snapshot pages that shows you some good information. So now onto the last part. Part D as in drugs, that's your prescription drug benefit. So if you don't get Part D, and actually Part B, when you're supposed to, by Medicare standards, then you're going to have a penalty imposed upon you until you actually get one. Okay? Penalties we'll talk about in another video. You may have already gotten that one actually. Page 5 shows some more info on Part D stuff. And page 79 through 90 digs deeper into prescription drugs. But to summarize it, right here is where you're probably going to pay anywhere from $7 up to $100 plus to an insurance company to basically help you get better prices on your prescription drugs. Now, I'll be honest that if you're taking mostly all generic medications, you're probably not going to save a ton of money on the cost that you're spending per month versus the medication cost you're saving. However, if you take just one name brand medication, then it's most likely going to be well worth your premium. Okay? So the biggest piece to take away here is really, really important is I don't care what you do, when you get a prescription drug plan, if you're a do-it-yourselfer, go to Medicare.gov, plug in all your medications, and see which company comes out with the best cost structure, both in monthly premium and in co-pays and deductibles. And on their website, it'll actually give you the whole total year's cost, all that included, and you can kind of compare all the plans. And then go enroll in that plan, okay? Very, very accurate. I've found a few little minor hiccups, but not anything of any significance. Second option is work with an agent licensed that can help you discover who's best and what's best, okay? And they'll do the same thing. Maybe they have a system like our team. We have a system we can plug all your medications in, and it'll tell us which plan is the best cost-wise, deductibles, co-insurances, co-pays, premiums. Because many people believe if I pay more for my prescription plan, it's going to cover more drugs and it's going to cover them at lower cost. Generally, that's not the case, okay? Some companies might cover these prescription drugs that are name brands, and some companies may not. So yeah, that one might be better if you take these 2 medications that are name brand versus these other 4 or 5. So again, it's always good to compare that 1 or 2, get with a licensed agent so we can kind of help guide you and teach you how it works. Again, I'm a big proponent of having an agent for a couple of reasons, and I'll wrap this up by just saying we're going to be there with you for the long term. We're going to be by your side. If something comes up, you can call us, we can work through it. Sure, you can call the companies. Yes, sometimes the agents may have some better insight. Or we say, hey, you got this new medication? Okay, cool. Come AEP, annual election enrollment period, we can look at some other prescription drug plans and see if there's a better plan for you. So I hope this cleared up a little confusion for you today of what Part A, Part B, Part C, and Part D cover. The whole alphabet soup of Medicare. Again, high-level overview, dig into your Medicare book, reach out to a local agent. My number is 337-322-0415. Be more than happy to talk with you. Shoot me a text. You can email me, rw@graceagency.org, or you can go to imtalkingmedicare.com, and we will simply get a contact form from you. We'll reach out and see what we can do to help. Again, no pressure on our side, no pestering, no bugging you, no inundating you with emails and phone calls. We're just going to give you the education you need at the pace at which you want it. And we'll show you how it all works. Thanks for listening. Hope it helped. We'll talk soon.